Welcome to part 2 of the MoMe billing and coding webinar. If you're looking for part 1, where we discuss procedure and ICD-10 codes for the MoMe modalities, please click the link on the description to part 1. Here we will discuss coverage by public and private payers and point to additional resources that we provide.
Just want to note here, all coverage, duration, prerequisite tests, and number of tests per year are determined by the plan the patient participates in and should be confirmed by the practice when benefits are verified prior to services being provided to the patient. Before we talk about coverages for these two, in general, for private payers with MCT, we recommend always seeking prior authorization or predetermination until or unless you know exactly what is required by that particular payer for a given line of business or contract. In general, even if the patient meets particular indications or requirements, if there is a prior authorization required and it is not sought, the payer can deny on that basis alone. First here, we will get into Holter and event monitoring. Holter monitoring has near universal coverage, generally with no prior authorization required. In all of the policies we reviewed, we have yet to come across a single policy that requires PA, prior authorization. This is often used as a first-line test before extended monitoring. The event monitor is also a legacy test that is widely accepted. The indications often require more infrequent symptoms or perhaps that a Holter is run a non-diagnostic. Generally, this test can also be performed without prior authorization. Moving on to MCT, for Medicare, there is a national coverage determination and several local coverage determinations giving Medicare coverage for MCT. Medicare does not do prior authorizations. They do have the right to review after the fact, so we do recommend maintaining documentation, justifying medical necessity, so it can be accessed in that instance. Depending on your Medicare administrator, certain service limits exist. Generally, they limit MCT use to once every 6 to 12 months on a patient. There are two common ways of meeting Medicare coverage standards, and the first is a previous non-diagnostic Holter monitor. When using this method, make sure all indications and previous monitoring is provided with medical necessity documentation when you're billing for the MCT. One important thing to note here is that if you are using a previous test like a Holter before an MCT, and that Holter is used as documentation to show medical necessity for MCT, these are still separate tests and both should be billed for. So if you perform a Holter, it comes back negative, or for whatever reason you think it is medically necessary to put that patient on an MCT, you should bill for both. The other common way to get Medicare coverage is if the patient has infrequent symptoms such that a Holter monitor is unlikely to diagnose that patient. In this instance, you can move directly to an MCT. So if a patient comes in with a covered indication, but the symptoms happen infrequently so that you probably won't see it on a 24 to 48 hour Holter, MCT can be ordered without the initial Holter. Again, make sure these indications are documented thoroughly and that it is explicitly clear that symptoms are infrequent such that in a physician's medical opinion, they would be unlikely to show up on a Holter. This is critical to avoid potential problems or any scrutiny during a review that any testing was ordered improperly. Another key point about Medicare patients, with Medicare Advantage plans, which are sometimes referred to as Medicare Private, Medicare Replacement, any Medicare Part C plan, they are required to adhere to the same coverage standards as Medicare. This is regardless of that payer's commercial coverage policy. So if a payer doesn't cover MCT for a commercially insured under 65 patient, that same payer must cover MCT for a Medicare Advantage patient and is subject to the Medicare requirements. However, they are allowed to perform their own utilization management. So the Medicare Advantage payers are allowed to institute their own prior authorizations. So just as with all other private payers, we recommend prior authorization of Medicare Advantage patients until or unless you know otherwise for a particular payer or plan. Commercial payers are free to create their own coverage policies, and coverage for MCT is more mixed among the commercial payers. We do track commercial policies for several of the larger payers and many small ones. So for specific details or additional guidance, please feel free to reach out to reimbursement@infobionic.com. I will give a brief overview of the commercial coverage landscape, but this is not intended to replace any guidance given by the actual medical policies or payers, and those should absolutely be consulted. And once again, we recommend prior auths for all privately insured patients unless you know otherwise with a particular payer. Some of these commercial payers do explicitly require authorization for MCT in all instances. So going into the national payers, Aetna, Cigna, and Humana all have positive coverage determinations for MCT. So if patients meet their indications and requirements, they will cover MCT. Important to note that many payers that do cover MCT also require a non-diagnostic Holter before MCT coverage. So please consult those individual policies. One of the advantages of the MoMe Kardia system is that for those patients that do require a prior Holter, after completion of the Holter with prior authorization requirements met, that patient can be remotely switched to an MCT without the need for the patient to return to the office or wait for a different device to be shipped to them. United Healthcare has a mixed policy. They will cover MCT after an ablative procedure or with cryptogenic stroke history, but will only cover for traditional arrhythmia symptoms after an extended event monitor is performed. The Blue Cross Blue Shield plans are a bit more complex. All of the different BCBS plans have their own coverage policies. So Blue Cross Blue Shield of Florida does not have the same coverage policies as Blue Shield of California. There are some that have positive coverage, some flat out do not cover MCT, and there are some that cover for very limited indications. For example, the largest BCBS plan, Anthem, also known as Empire in some ways, in some areas, or Blue Cross Blue Shield of Georgia, they only cover MCT with history of cryptogenic stroke. So please consult your BCBS policies or reach out to us for guidance with BCBS reimbursement at infobionic.com. The other important thing to note for patients with BCBS coverage that are not covered by your local BCBS plan. So, for example, a patient in your clinic in Kentucky, which is an Anthem state, has their company's health insurance based in Massachusetts. So they are insured by BCBS Massachusetts. They are actually subject to the BCBS Massachusetts coverage policy. So the general rule is that the payer on the card is the policy to abide by. The general procedure for out-of-state BCBS is to authorize the patient's home plan, the plan on their card. So in this example, it would be BCBS Massachusetts. And then if you receive authorization, submit your claim to your local Blue as you normally would. So in this example, you would submit it to Anthem in Kentucky, but do include the prior authorization you received from the out-of-state Blue, Blue Cross Blue Shield of Massachusetts. This is also critical to understand in the reverse situation. If your local BCBS plan covers MCT well, but your patient is covered under a BCBS policy out of state that does not cover MCT, you might be putting your patient at risk for an unexpected balance bill if you order an MCT. And you might not know it either, as there's a possibility you might be reimbursed as normal by the local Blue, but then the patient would be balance billed by their home Blue. For smaller local payers, they often don't publish policy on MCT, or the policies are not public. We do track several local policies, so for guidance, please feel free to reach out to reimbursement@infobionic.com. But the best source of information will always be on your payer web portals or by contacting the payer directly. As mentioned before, we recommend prior authorization for all commercially insured patients until or unless you know otherwise. Please check the medical policies because often MCT is covered but under more specific or limited indications than Medicare. So coverage for Medicaid is determined at the state level. For traditional fee-for-service Medicaid, most states do have MCT coverage, but others do not. Feel free to reach out to reimbursement at Infobionic for guidance specific to your state. But you can also find coverage information as well as reimbursement amounts on your state Department of Health website. As MCT is a newer technology, some of the fee schedules will not have determined standard fees yet, and sometimes it says manually priced or no fee established, or on some it may just say zero. This does not necessarily mean it is not covered. If you run into this, feel free to contact reimbursement@infobionic.com for guidance on this. Most states actually operate under managed care arrangements largely, where they give private payers the responsibility to administer Medicaid coverage. These are called managed care organizations, or MCOs. The states give varying levels of leeway to the MCOs to interpret medical necessity and coverage levels. Overall, though, generally they're supposed to adhere to the level of coverage that their state fee-for-service Medicaid provides. However, this does come with varied leeways. They are also allowed to add prior authorizations. So as with other private payers, we do recommend prior authorizations for Medicaid patients under MCO arrangements. If you do receive denials on Medicaid or have questions about MCOs, please reach out to reimbursement@infobionic.com. Lastly, we want to touch on some resources that Infobionic can make available to support proper coding. The coding guide has appropriate procedure codes, common national Medicare rates, and a common list of ICD-10 codes that several payers may use to indicate coverage for cardiac monitoring. It's the same list that we showed you earlier in this webinar. Most often, specific information about coverage and applicable ICD codes can be found in medical policies and for Medicare and the local coverage determinations. For questions about specific payers or identifying your Medicare administrator's policy, please reach out to reimbursement@infobionic.com. We also track several specific coverage policies and can assist with guidance in navigating coverage for all MoMe Kardia modalities. To reiterate once again, we do recommend practices receive prior authorizations for any privately insured patient until or unless you know otherwise. We do have resources to help with this and streamline this process, including a prior authorization template letter, medical policies, as well as some support if appeals are required. Thank you for engaging with the MoMe Billing and Reimbursement webinar. If any assistance is needed, do not hesitate to reach out to reimbursement@infobionic.com. You can also work closely with your local clinical support, customer success staff, and sales representatives, and they can put you in touch with us as necessary. Thanks so much. Have a great day.